On behalf of the Interdisciplinary Network and Academy of Science, Office of the Royal Society of Thailand, I would like to extend a very warm welcome to all of you, especially those who have traveled far to attend this first Asean Art Therapy Conference. We appreciate your taking time off your busy schedules to join us today. We hope you will find the program we have lined up for you to be fruitful and emerging.
การทางด้านศิลปกรรมบำบัดนะครับให้เกิดมาตรฐานเป็นที่ยอมรับ
And for this author, I am now here to distinguish the cultural threads that will identify and unify us in our pursuit for our career, goals, and purposes in life. Now, to give you a brief background of our Philippine setting, so we all know that we have been identified belonging to the third world country. But as years progress, we are now a developing nation. But it cannot be gainsaid that poverty is still a problem in our country in several regions, particularly in children, between the period of 2003 and 2009. But as the saying goes, that at the end of the rainbow there is a pot of gold, there is always hope, especially when it was decreed in Article 3.6 of Presidential Code 603, known as the Child and Youth Welfare Code, which emphasized that every child has the right on education commensurate with his abilities and to the development of his skills, for the improvement of his capacity, for service to himself and to his fellow men. Now with these three magic words, part, partake, participate, my problems were formulated. For number one, what part does art therapy play in the improvement of living in the Philippines? Number two, how can learners partake in some art therapy programs in order for them to acquire the necessary art skills and for them to utilize their indigenous resources that will sustain their environment? You all know that in 2003, we have been devastated by a typhoon Yolanda, which greatly affected the Visayas region of our country and in Tacloban Leyte particularly. So here we were grateful that many countries, neighboring countries, have contributed their support and help in whatever ways they can be. And for our part as art teachers, so we have extended our support by coordinating with some networking foundation in order to provide art therapy workshops with the kids. So you can see from their works, most of the topic of their artworks are houses, the landscape, the seascapes, because these are the very things that they have been deprived of. And so in order for them to come out with a kind of purging out of their emotions, they were given some kind of art activities. Okay, so next we have the Art Teach, Art Reach in our university where I teach in the fine arts. So we have the community extension project which reached out to this particular patients or this particular children, especially those in the community, the daycare children, those victims of some abuses, and then street children or at-risk boys.
Then participate in various art therapy programs for our children is highly sought, but that is not yet fully met because of some limitations. And then partake, wherein we follow some kind of government policies and guidelines as a strong points for every institution to move towards the direction which in return will benefit them. So gauging from all these evidences cited from the different art therapy programs, the author had discovered certain directions in various approaches, which in the end are all geared towards the development of art in every individual, with emphasis on creativity and maximizing their potentials. So I hope that this simple presentation has presented the current situation of children in the Philippines through various concerns, such as the need for proper assessment, education, administration and governance, budgetary allocation, of course, and then involvement of those stakeholders and participation in all projects that all will lead to art therapy and as a whole towards the enhancement and sustainability of our environment and the community. So for now, at your service, thank you.
I'm extremely delighted to be here today to present the Red Pencil. The Red Pencil is a humanitarian mission who has the benefits to bring art therapy to all population who are going through such overwhelming circumstances that they have no words. We have a special focus on low-income families because we believe that people who have the financial means to pay for an art therapist, it's all the best for the art therapist, but we want to be there for all the people who do not have the financial means and so can count on a foundation to support them. Our vision on the very long term is for people to learn that they can already do a lot to take care of themselves, of their mental, physical and emotional well-being through art therapy. So the structure of the Red Pencil is that we have actually two Red Pencils. We have one which is called the Red Pencil Singapore, dedicated to Singapore because that's where we live and that's where the whole program started, and where we are officially a charity with what we call in Singapore an Institute of Public Character. This is something which is being promoted by the government of Singapore, where every donation given to Singapore and where the beneficiaries are in Singapore gets a 300% tax rebate. So we are partnering today with about 55 organizations, but I will explain that a little bit later on. Then we have the Red Pencil International, which is altogether a different organization, and where we are, I will give you more on that in a minute. So our three goals are the following. First is Singapore, where we work with children, adults, families, caregivers, people belonging to corporate organizations and may have a lot of stress in their life. We try to extend our reach to as many as possible to benefit of art therapy. Then the second part is intervening, of course, in humanitarian mission. And we have in natural disaster in conflict zones, but also with NGOs which are established in all the countries you can imagine. So we partner with them and we organize programs where we have art therapists coming either from Singapore or from other parts of the world now, because we have a large network of art therapists, and we organize missions there. And then otherwise, what we also do is that we work with very large organizations like, for instance, the Singapore Red Cross or Doctors Without Borders or CARIS, which is another one. And with those organizations, they are well organized and they intervene very quickly, for instance, in natural disaster, and we go along with them to bring the psychosocial support through art therapy. Something that I want to explain about our missions overseas is that the Red Pencil started about 3.5 years ago, 4 years, and along the process we have learned that what is very important, because we talk about art therapy, is that all the work that we are doing is in-depth, long-term, and of course extremely professional.
We have done Myanmar, we are going now to Cambodia for human trafficking and sexual abuse victims. We have been in Bali in a very different way for children with disabilities. We can go on and on. Very meaningful project, wonderful people we have been working with. And I would like to finish by first introducing you to Manuela, who is in charge of our international mission. So we are there to help you. We are there to bring some art therapists to support whatever you are doing in your country. And if there is a special project where you say, well, we would like to have Singapore, we have opened also an office in Geneva because we have other requests in different parts of the world. So we are expanding rapidly. So it's an immense joy, of course. And if we can help you in any way, just approach either Manuela or myself. Take note your own name cards, and of course we will be delighted to share, to support, to do things with you that will also make everybody benefit. Thank you for listening.
I have my second job. I work as a food critic. Have everybody see the television program called the Iron Chef program? Yes, sometimes I work as the judge, the food critic. That's why I can use my nose, my smelling technique, something like that. I was approached recently by the drama student. I have a third job. Sorry to say, I'm doing the theater also. I'm playing the Shakespearean acting. The last 3 years ago, I'm doing the Macbeth. It's very bloody, something like that. So that drama student come to ask me because he's working with the blind people. So I said, yes, with the blind people, and what kind of art, what kind of theatrical method that he uses. I said, actually, he's a pantomime artist. Very good, like Marcel Marceau style, something like that. We love that. But actually, he feel that, yeah, they can use the body, they can walk, they can listen to the sound, but what else? So he just asked me for the last and the missing sense of human organ, that is the olfactory. Everybody's here, you not blind, right? So we are very vision animal. But sorry, it's bad than a heart, it's bad than the simple fly insect. But actually the things that you see is a texture, color, the light, the shading, we call the visual scape. Like this. Extraordinary, especially in Bangkok, in Thailand, in the daytime and the nighttime, very spectacular. And what about the soundscape? I'm silent. Do you hear some kind of a buzzing of the air condition? You see a little bit strange noise from that side? Yes, clearly. Do you hear the heart beating of your room? No, yes or no. Sometimes you have to be in a very meditative stance. Everything we call soundscape. It's a very loud sound, but now it's a very background, quite soft and low sound. And what about the smellscape? You smell something now? Really? You smell something? Do you feel the watermelon in front of you? Not really, but it's real watermelon. Right? You have some tea or coffee in front of you. Sometimes you do not recognize the smellscape. But actually, my drama student, he asked me a very good question, is that he has one of his blind actor who can walk without using the stick. So I asked, how could he do that without the walking stick? So he said, it's very, asked the blind, he said, it's very simple. He can count the walk, the step, and he know every details. Oh, it's hard, it's something. Okay, it's okay. In the very routine place, you can go there. But it's not actually by the haptic. Haptic means the touch. It's other thing is that he can listen to the soundscape around him. Soundscapes around him. Okay, this is a coffee shop, something music. This is motorcycle, something. but actually he used the last sense. That actually the sense for the blind people is much sensitive than us, the normal vision people. Okay, the smell scale. I will explain in a very simple way, not the scientific words, it's okay. When you smell something, we call the fragrance. If it's good, we call fragrance. If it's not so good, we call odor, right? The odor is pejorative word, something like that. But in scientific term, we call odor, whether good or bad. When you smell some molecule transfused in the air, it would come to your nostril here. But one exercise, you can do it right now. You close one, and you open one. It is very normal for everybody that these two nostrils will not fully open at the same time. If you are doing some kind of pranayama, the yoga of breath, you will know this detail exactly like this mudra. You have to try it. So it's very scientific, it's very common, but do not ask me why. We do not know. It's nature. When the smelling molecule comes here, it will touch the first nerve. We call the nerve the olfactory nerve immediately. And in this diagram, that nerve we call olfactory bulb. Bulb is the blind end of a nerve. That is the first nerve of human being, and it's always called the rudimentary nerve because we do not use it quite a lot. But the nervous tract is very different and very interesting. They will send a signal through the olfactory bulb, go on along a way until that limbic part of brain. So what is it? What the heck is that, the limbic? The limbic part of the brain is a very primitive brain of everyone here. It's very rudimentary and primitive, as in the lizard, in the turtle, something small creature. It's a very vital part of our brain to control the temperature, the sex, the memory, and the emotion at the same time. So scientifically, when we use the word odor, it doesn't mean it has to be good or bad. The first thing is that it will communicate some kind of a message to the brain directly without going to the cortex. So it's very, very special sense. For example, via very vision. The light and the color comes through the eyes and go on the second nerve. No, you feel nothing. It will transmit the signal until this part of the brain at the cortex, and you will see. So it takes quite a little bit long time. But for the smelling, it's immediately, very immediate. Unfortunately, in their whole life, they do not enjoy a lot upon eating, because normally the blind people always eating exactly the same thing in the same place at the same time. They have no chance to discover other new delicacy, new exotic ingredients. So that's why the orthonasal means we smell something directly through our nostril, like this. Or sniffing, we call orthonasal. For the blind people, it's superb, more than us. But the retronasal, when you put something, put a drink in your mouth, do not swallow, and you feel something, and you take a deep breath again, everybody will feel the strange smell. We call retronasal. And for this retronasal skill for the blind people is a little bit poorer than us. So that's why the project, we try to combine lots of things concerning with the smelling. For example, this is a project.
The mother's role now are reduced in time, We give it to caregivers, but mothers they don't have sometimes their parents, that the grandparents are not around either. So we rely on other substitute caregivers, and juggling time between. With the survey also that when you juggle time between work and place, the nearer you are to your work, the better. Because now we can see that all of this child rearing is still possible even we are working outside, as long as we take consideration of the three topmost in the survey that came out. First, the education of the mother. Number two, the proximity and the income of the mother. Those things help also in the development of on the rearing of the young mothers right now. However, as it is now, how do we now improve this? Because these are the things that came out. We ask ourselves, therefore, whether art therapy can be part of the child rearing process. So this could be another step in the study, whether we can include art therapy as part of the child rearing process. So we also ask, is there a significant difference in child rearing effective parenting between full-time and part-time mother? We have not done this research. And so we ask also, is the working mother changing the concept of the family now, most specifically how a child is brought up? What can companies do to support working mothers? In our school, we have a daycare center wherein all mothers with young children can leave their children until they are finished at work. So, other studies that we can explore from a different perspective, will this now we will not really truly appreciate this sociological impact of two working parents on the way our children turn out. This will probably be evident only in the next generation. Only then we will realize the true cause of working mothers in the country. So these are all references. I would like simply to acknowledge Ali Thompson, who is now a grade 5 student at UWC in Singapore, for the illustrations of this PowerPoint presentation. And thank you very much.
It's my honor to be here and share about the music therapy in Thailand with you. I know that this mainly we talk about art, and maybe I'm one of the few that talking about music therapy. The topic I'm going to speak within 10 to 15 minutes. There are like music therapy definitions, a little bit of traditional music healing and organization, education, research and development.
The definition, as you know, that art therapy to help supporting many aspects of life to help human have a well-being, healthy life. But the American Music Therapy Association, especially mentioning that music therapy process must involve the credentialed professional, which we don't have, and must have the certification for music therapists. Too, we don't have either. And Australian Music Therapy Association also talk about definition and mentioning about university trained professional. We still don't have yet. We have one just finished master degree, master of art, but not music therapy. Like we have a long history of music therapy by the definition of music and healing by Aristotle and Plato, just like that.
But the American Music Therapy Association, especially mentioning that music therapy process must involve the credentialed professional, which we don't have.
People from New Zealand were originally the Maoris, who came from Eastern Polynesia, and they used their sophisticated navigational knowledge and practices to settle in New Zealand. And that was approximately 1,000 years ago. They also brought with them spiritual, cultural, musical and artistic traditions. And in Singapore, Indigenous Malays are known for their artistic and musical cultural traditions. In contemporary society, and importantly, these Indigenous artistic and spiritual traditions continue to influence the current Asian and Pacific cultures, including models of health and well-being. And these traditions are increasingly being valued by Anzata and the art therapists who operate and practice in Australia, New Zealand and Singapore. And each one has an influence from the West. For instance, Singapore has developed high standards of healthcare and education with progressive policies on environmental sustainability. And its multicultural and cosmopolitan diversity have contributed to global success while incorporating the West and the East. So the development of the profession. This is an image from Jill Westwood's thesis in 2010 called Hybrid Creatures. And she studied the art therapy training courses and education in Australia. It has a relatively recent history as a profession in Australia. However, our association is the oldest and most established in this region.
So at the end, we compare the differences in reducing stress among the control and treatment groups. So in this study, we used questionnaire. Also, we used triangulation of source, interview, observations, and analysis of documents, drawing, and artworks. This is our procedures before we start the project and the research. We distribute the informed consents, and we start with pre-test and 12 session in art therapy. So while using the art therapy, we make observations, we make interviews, and we also observe the artworks. And after finishing 12 sessions, we conduct the post-test, and we analyze the differences between pre and post-test according to alleviating the stress among teenagers, girls who experience sexual abuse.
It is the figure, a comparison of stress before and after the art therapy session of treatment and control groups that shows for treatment group, experimental group is 3.401 and decreased to 2.771, but control group have decreased also 3.212 and decreased 2.953, but treatment group more than decreased from that control group. For discussion, art therapy is a good medium to express their emotions. The art therapy also is a medium that has therapeutic relief. From the supported qualitative that subject was states that she felt calm after had released all her suppressed all this while. This shows that there is some effects against stress faced by the subject after attending an art therapy sessions. The subject feel more relaxed because they can express their emotion. Discussion is, drawing is an exploration medium means to bring forward the message of image on the painting.
Postgraduate traditional training in psychodynamic art psychotherapy, as well as my 17 plus years of full-time practice as both a practitioner and educator within postgraduate study, I personally define art therapy as a hybrid professional discipline that draws upon and incorporates long-established traditions of art making, psychology, human development, and creative self-expression through a facilitated and informed process with another human being by means of a therapeutic relationship. It is practiced within safe, legal, and ethical parameters. Within Asia, art therapy continues to redefine itself based on the reality, complexities, and interrelationships between the human condition, experience, culture, and an innate desire to engage with others. Regardless of definition, it is hoped that art therapy will be respected and provided a proper and more formal place within accepted mental health services that have been encountered given the very real complexity of culture, stigma, and of therapy itself within an Asian context. The introduction of a postgraduate training program at LaSalle College of the Arts in 2005 was progressive and innovative. Although this is the case, much education and development has had to take place outside of the traditional educational form itself. So this presentation is a brief snapshot of the development of art therapy in Singapore. I work for Singapore, so obviously I want to welcome you to LaSalle College of the Arts. I work in Singapore. Okay. All staff are trained, credentialed, and maintain professional memberships with various local and international professional arts therapy and credentialing organizations. So here you can see the world's leading arts therapy international organizations and also the credentialing bodies. Graduates of the program, she is now a full-time lecturer, which really speaks to the maturity of this particular training program in Singapore. She brings a local context and flavor and is able to readily relate with the students. So all of our backgrounds and research interests are varied, which supports a balanced and complementary team approach. This enhances the overall learning environment and the experiences for the students. All of us remain actively involved with the professional art therapy organizations, and we provide workshops, presentations around the world. Students are kept informed and where appropriate are invited to attend and or participate. This is very important, especially for those students that will be practicing and living either in Singapore or within the region itself.
Music study can be used to treat the children with special needs. If the teacher knows how to use the music systematically, the children with special needs may receive a lot of benefit from the music. Music can promote confidence, muscle movement, visual ability, hearing sense, and directional learning. Children can have better development and suit their disability. Moreover, they have better learning skill. As a result, music is widely used for children.
Now it's 5 o'clock. I think everyone is feel very sleepy. So I'm gonna open the DVD National Cancer Institute that my faculty come to give the music therapy. One of the main reasons people with cancer use music therapy is because it makes them feel good. Many of us know how calm and relaxing it can be to listen a favorite piece of music. It can help people with cancer to cope with side effects such as pain, anxiety, depression, sickness. So in my faculty in music therapy, we go to National Cancer Institute to give them the music, to play the music for them. You can see the cancer, they forgot the pain in the body and make them feel happy.
kept working on it until I need to step in. I gave him some advice which part to add that need more clay so it can balance the whole body. This is to help him to get in touch with the flow. The flow will occur when there's a balance between the challenge and the person's skill. If the skill level is too high or too low for the task, that person could become bored, nervous, or disappointed. So Aaron was able to get in touch with the flow again. When finished, we talked about this ostrich, and he said, I told him that in this session, the ostrich seemed to be stronger, and Aaron said maybe. So I asked him what made his ostrich become stronger. Is able to project a character that he or she want to develop into animal symbolism. Aaron might want to develop this part in himself. And tracing back to the previous session, the effects of the container now can be seen in this session that Aaron might introject and process what I reflected back to him. Oscar feels angry. I asked him further what made Oscar feel like that. He said his friends steal the food. Experiencing violence at home may cause a child fear along with aggression. Aggression and anger are often displayed behaviorally. However, it can be repressed and hidden.
And facilitate and train people about what I have studied, what I gained from UK, and I also work with Islamic Council to develop Islamic perspective, because in Malaysia, most of people in Malaysia mainly Muslim, so we want to try to adapt Western practice and how can we integrate with local context and also multicultural sensitivity. Like Mr. American, he conduct a lot of creative art practice within various multicultural context in Sarawak, and also introductory short courses for helping profession and for education. That's something we are working now, and also, as I mentioned, practice art-based intervention. For example, integrated with motivations. This is something maybe we need to make things more flexible within Asian context, because we don't have. I know that we have strong program with MA in art therapy in Singapore, but then for others country we need to adapt with a government policy. Like in Malaysia, adapt in helping profession, or if I want to establish master in expressive art therapy, registered or whatever, just within Malaysian context. Because if we want to follow international standard, that will take us about many years to establish the program, and by that time everything will become chaotic, because there are so many people will do so many things. This is, I'm talking about a public agency. There are a few private agencies that practice properly, follow the international standard, like those who attend, who went abroad, who have master in art therapy, in play therapy. They understand the rule and regulation. But this is like just isolated and small community in Malaysia. I'm talking about the wider public community. And also, I'm hoping that Asean Creative Art Therapy Association will be an umbrella for training and practice. I mean, maybe standard curriculum or whatever that we can discuss together, and more conference like this, as like Dr. Kasmawati mentioned just now. We learn a lot from this. Yes, to be honest, we learn a lot from this one day's sharing from this morning, and I feel so impressed with so many advanced program in Thailand especially, and also we have good sharing from our President of Anzata and Mr. Ronald, who have experience from Western to adapt how they can adapt within Asian context. And also, I want to work to establish, as I mentioned, registered creative art therapies or expressive art therapies within Malaysian context, because I want to make things clear. I don't want people who just attend short course and then they say I'm registered art therapy, I'm this. So this is something that I feel like this is my responsibility to not to control, but to make things something professional practice. And I know this is something not easy for me, but then I know I have another 7 here, creative art therapists who have strong passion can go alongside me. And Dr. Zeti extensively have conducted research at her university with a master and PhD student in expressive art therapy. That's something quite good for us to show to people in Malaysia that this is art therapy, this is expressive art therapy field. Something a bit different if you want to compare with counseling or psychology in Malaysia. Okay, so I think that's that all. Thank you. Terima kasih. Arts for Living Room and Creative Potential.
Art therapy is the use of art media and images for the treatment of psychiatric and psychological conditions. That is the baseline for art therapy practice. Art therapy is interdisciplinary, involving psychiatrists or psychologists and art therapists. This is why I invited some psychologists and psychiatrists to this conference, because I'm aware that we need to collaborate across the disciplines. On this occasion, I shall talk about my experience regarding the practice of art therapy in Thailand during the past decade. Board of Certified Art Therapy in our country. Only a minority of psychiatrists and psychologists employ art therapy back to the early 70s. At the beginning, almost pioneer in art therapy were lady psychologists, and the trend is the same. We have more female art therapists today. Yes. Up to the present, there are few Thais fully trained art therapy abroad. Yes. This is happening here. Yes. And as you know from our Thai speaker this morning, that art therapy institution that incorporate art in their therapeutic settings include many institutions and private clinics, private practice and center. For example, Human Center is a center of art therapy in Thailand, the only one that provides a certificate education, a sort of diploma education, and they cooperate with a Canadian College of University of Art Therapy and some other organization. Yes. So everybody been doing their own works a lot on the art therapy. It started in Thailand. I mean, the full recognized Board of Certified Art Therapy has started in Thailand after the first National Art Therapy Conference in 2004. That is the point where all the Thai practitioners realized that art therapy needs to be certified for full profession. This is when I organized the introductory course on art therapy with 6 distinguished US art therapists who came here, and one of them is Judith Rubin. It's very important art therapist from US. And the meeting has involved, you have heard from Dr. Natrika this morning that at my university where I teach also incorporate art therapy as a subject in the art education program. Yes. So the following picture were drawn by the 6 post-traumatic children demonstrating their suffering. I'm going to show you a bit about my research with psychiatrists in Thailand. So I'm not a certified art therapist, but I work with psychiatrists on project and research. So this is a co-study work, and there's a picture of the mudslide disaster drawn by the victims. Yes, you can see that in this process, art therapy process, I use the PTSD model with, as you know, CBAT or cognitive behavioral art therapy model. We have the children go through the 4 stage of art CBAT and to alleviate them from the trauma. And this one is quite successful drawing because the victim, the client can revisit their traumatic experience. So the art therapy practice on this group of sufferers from natural disaster event in the northern province of the country show beneficial result of art therapy. The second research was on the flood victims in 2012, and you will see that art is a good media for expression in this process. Yes, these are some of the drawings belong to the victims. So other study will concentrate on elevating depression and behavioral development. So because my base is art education, so my point is we talk about establishing the full profession of art therapy. We talk about how to certify art therapists. But we also have to remember that we have art education that can reach out to all humans, and that is a good avenue for teachers and other practitioners to work on the art in therapy. So I think I have done some way since 2004 until now to try to promote this discipline in Thailand. And like this is another project with female inmates in a province in Thailand to raise their self-esteem, because it's very important concept, psychological concept of self-esteem. It works very well in inmates because they are so depressed. And this one, you will see that I show the face, the picture of the children, because this one is art education to therapy. It's not a full art therapy. So we have to be aware that a lot of teachers, a lot of practitioners also who are not bound by the Western code of practice, they also have been using the art therapy in their practice. And in 2010, I was invited by the Northern Illinois University to speak on art with PTSD in their conference. And on the academic area, I have published 3 books on art therapy. The first one is Art as Therapy, edited and translated from Edith Kramer book, Art as Therapy. And the second one, Synopsis of Art Therapy, is contain a lot of content from different art therapists around the world and in Thailand. And the number 3 I published last year is Art Center Education and Therapy for Children with Disabilities. Some of you might know this book. It's written by Frances Anderson, and I translated. So the 3 books are now on the bookshelf of Chulalongkorn University bookshop. And in Google or either in Thai or English, you will find a lot of publication done by me because I think it's important for education to get into deeper understanding of the field. As we've been talking about, that there's a lot of issue regarding this art therapy practice in this region, because we don't have the code of practice like in the US or elsewhere in the Europe. That's the problem, and for this, I think on this special occasion this year, the ASEAN Economic Community will be erected, and so the coming event inspired this conference that I invited you all here to come and also to help together to join hand on establish the ASEAN Art Therapy Conference, and then the next we might be able to establish our association here, and after the finish all the presentation, we will have a panel discussion. So I would end here with my sincere ambition is to create art therapy networks around this region in ASEAN countries, and at least one or twice a year we might meet for get together to share the in a proper conference format. Okay, as recommended by Dr. Somchai, first, who's going to clarify the S behind art therapy, or behind the word arts? Shall we use art, just art, or arts therapy? That's one thing. And the second one, Dr. Somchai suggests that we nominate our second host of this ASEAN Art Therapy Conference. So we can do nomination today, okay? Who want to be the host for the second one? Yes. Anyone would like to clarify? I think Joe, you can.
The problem when we do this work in our own time, and but for the generosity of yourself and my association in funding me to come here, it would not have been possible for me to come here. So I don't think we are ready to fund or host at the moment. I would have to take it back to our committee anyway, and we would have to have a conversation around that. It's not out of the question, it's just whether we've got the resources. We've had burnout in the past with committee members, which has caused an immense problem, and as president, I'm really aware of that, and I'm determined that our committee remains strong and that we do only what we can do. We don't run before we can walk. So it's not out of the question, but probably this is a little bit premature. But thank you for this, for thinking we might be able to. I will take it back to the committee though.
Yes, thank you, Joe. I think we have very common problem on
Yes.
Budgeting and everything. But as you have been more mature than ASEAN country, if we develop the association, we would of course consult you in the times being. But would you also clarify on the letter S behind art or no S?
When we had the debate and included the S in arts, music therapy isn't included because music therapy in Australia and I believe New Zealand has got its own separate structure. It is an older, more established association compared to ANZATA. So we don't include music, but drama and dance and expressive therapies, art therapy and play therapy also has its own association. But we would have somebody as a professional member as long as they have the requisite qualifications. So some people are qualified as a master's in creative expressive therapies or expressive therapies, and as long as they've got the requirement, then they can join. But it does exclude music therapy only because they have their own association.
Yes. I think many of us agree with you, Joe, because even in Malaysia or Thailand, we also have play art therapists who use a lot of things like American from Malaysia. He also work on toys and play with children, and I think this sort why the word you use the letter S between art. I think it's more broader for the other areas to coordinate with the art. but I'm not sure about the correction in language. I mean, yeah. Yes. Any more ideas from everybody? I know we have a long day. Yes. How about you, Dr. Papansa? Dr. Natika, any idea? Oh.
Everybody, ladies and gentlemen, saya sangat senang menghadiri konferensi ini, tetapi saya menginginkan konferensi itu aktif dalam interaktif, sehingga saya berharap ke depan kalau konferensi ini terus berlanjut dan ini untuk kolaboratif untuk seluruh ASEAN, asisten Prof. Lesering yang sudah mengundang saya, walaupun tahu saya tidak bisa bahasa Inggris, tapi beliau sudah menyatakan bahwa ini dua hal trauma ini tapi bisa dilakukan dengan art terapi, dan ini sangat bagus. Dan juga tadi ada terapi bermain, ada terapi yang melalui sosiodrama, dan ada terapi musik, menyelesaikan atau menangani anak-anak trauma yang sangat sulit.
But obviously, because the music association is developed completely separately, that we would have to start a dialogue with them to have that conversation in the first place. I think there's value in that. Whether the music therapists would come on board and whether the Music Therapy Association would be interested, I'm sure in theory they would, but I can't answer for them. Yeah.
Yes, but anyway, this is good information for our music therapy participants.
Yes, absolutely.
Okay.
What's impressive about this particular conference is that it's truly an Asian voice with an Asian perspective. And in terms of whether music therapy is included or not, well, why not? Because, you know, the voice here is getting louder and louder. The presence of the expressive arts, creative arts, all of them, you know, are emerging. So why do you have to be like the West? Why not have something unique here? What I think Joe was talking about, and I think is very, very important, is to recognize the established standards and use all of that to inform if a creative arts therapy association here is formed. So certainly acknowledge the dance movement association, the drama therapy movement, the music therapy, the art therapy. You know, a lot has already been written, and why not use some of those templates and further tailor it to this?
Yeah, we can further tailor this multidisciplinary art disciplinary therapy in the future.
The advantage of including music therapists in an association is that you increase your numbers. One of the major problems with Australia has been small associations growing up separately. It's a problem with psychotherapy and it's a problem with counselling as well in Australia, which is why neither psychotherapy nor counselling nor arts therapists nor music therapy are state registered, because everybody has grown up in little numbers, small numbers, and by uniting together you create a larger voice. And so I think the idea of having music therapists, certainly within the Asian context, is really positive. It's just in Australia traditionally we haven't included them, but
I think in that way we can grow and develop, and I think we can even differentiate between board certified profession and non-board certified for those teachers or artists who like to use art for therapeutic way. But we can let them know that you can do at certain level. You cannot do psychological assessment or anything. It's something like we have to discuss further on this. And also, you cannot do psychological assessment or anything. It's something like we have to discuss further on this. And Also, before I pass this mic back to our MC, I would like to everyone to thank you our master of ceremony. Isn't she fantastic today? Yes. Oh, who is she? And also.